While learning about behavioral and mental disorders of abnormal psychology this semester, we learned the basics on bipolar disorders. However, today I want to dive a little deeper into the complexity of bipolar disorders and different factors involved. There are two main types of bipolar disorder, type 1 and type 2. While these are both similar and both types include cycling between depressive and forms of a manic state, they also have some differences. Bipolar disorder type 1 is characterized by alteration of manic and depressive episodes. The biggest difference between the two types is that in type 1, there must be an occurrence of a full manic episode. A hypomanic or depressive episode may follow this manic episode, and there should be a history of major depressive episodes and/or hypomanic episodes. Type 2, on the other hand, is characterized by mixed features of hypomanic episodes and major depressive episodes. Type 2 does not include true manic episodes, and an individual who has experienced or is currently experiencing an episode of this nature would meet the diagnostic criteria for type 1. The diagnostic criteria for a manic episode involved in bipolar disorder type 1, as defined by the DSM-5, includes a distinct period of abnormally elevated or irritable mood, along with increased activity or energy lasting at least 1 week. At least 3 or 4 symptoms must be experienced during this episode, such as inflated self-esteem, decreased need for sleep, flight of ideas, distractibility, and/or involvement in activities that have a high potential for pain. This episode cannot be attributable to the physiological effects from use of a substance or another medical condition. The diagnostic criteria for a hypomanic episode involved in bipolar disorder type 2, as defined by the DSM-5, includes a distinct period of abnormally elevated or irritable mood, along with increased activity or energy lasting at least 4 days. At least 3 or more symptoms must be experienced during this episode, such as inflated self-esteem, decreased need for sleep, more talkative, flight of ideas, and distractibility. The disturbance must be observable by others, and it cannot be attributable to the physiological effects from use of a substance or another medical condition. Both types of bipolar disorders experience major depressive episodes. According to the DSM-5, a depressive episode involves the presence of 5 or more of the listed symptoms during at least a 2-week period, along with a detrimental change in functioning. Symptoms include lingering depressed mood for most of the day and nearly every day, decreased or loss of interest or pleasure in activities, weight loss or weight gain, changes in appetite, insomnia or hyperinsomnia, fatigue or low energy, feelings of worthlessness or unnecessary guilt, and recurrent thoughts of death or suicide ideation. At least one of the five symptoms experienced must be depressed mood and/or loss of interest and pleasure. The episode must cause distress or impairment in aspects of the person's life, and as always, the episode cannot be attributable to another substance or another medical condition. There is lots of research available on bipolar disorders due to the growing focus on mental health in general. While research and mental health concerns have grown, so has the prevalence of bipolar disorder. While bipolar disorder is still fairly rare, the global rate has increased drastically. According to a study done in 2013, in 1990 there were 32.7 million cases, whereas in 2013 there were 48.8 million cases. This data is not fairly new, but I'm sure the rate has increased since then too. Also from the study, Figure 1 shows the global prevalence of bipolar disorders among age groups. You can see the differences among the age groups and where the highest rates are. Like many disorders, research has proven genetics can play a role in the diagnosis of bipolar disorder. There are many gene markers that are thought to cause increased susceptibility, and the hereditary rate of such markers is very high at around 80%. Below is a diagram showing the different genes studied and where they are on chromosomes. As you can see, there is not a single gene contributing, but instead a large quantity of markers that research has related to a diagnosis of bipolar disorder. While still focusing on genetics as a factor, having a blood relative diagnosed with bipolar disorder drastically increases chances of a diagnosis. As seen in the table from a study done in 2012, there is a significant relationship between bipolar disorder and genetics. As you can tell, the more immediate the family member, the more likely a diagnosis of another family member. Unlike most mental disorders, bipolar disorder doesn't offer much variation in treatment. The treatment route for bipolar disorder involves a mood stabilizer such as lithium, carbamazepine, or valproate. While this may be all an individual needs in order to treat their symptoms of bipolar disorder, adjunctive psychotherapy can be done as well, along with their medication, but psychotherapy is not a standalone treatment on its own. While mood stabilizers are typically a successful treatment for bipolar disorders, like any treatment process, there are ups and downs, which makes adjunctive therapy a great option for individuals. Adjunctive therapy can be very useful for individuals with bipolar disorder to encourage their use of mood stabilizers and help them stay focused on their well-being. It is common for individuals with bipolar disorder to attempt to stop their medication. One reason for the pause in treatment is because the individual might feel as if they are much better and do not need the medication anymore. However, mood stabilizers are vital to the individual's health, and it is easy for individuals to spiral back into their cycling when stopping their medication. Treatment is very vital for individuals with bipolar disorder because the suicide prevalence is around 20 to 30% higher than the general population. Since bipolar disorder can cause cycling between manic and depressive states, individuals are at a much higher risk, and suicide is one of the leading causes of death for people with bipolar disorder. It is estimated that 25 to 50% of individuals with bipolar disorder will attempt suicide at least once in their lifetime, and 8 to 19% of individuals will complete a suicide attempt, resulting in untimely death. This makes diagnosis and treatment for bipolar disorder very important for individuals who suffer from it. Thank you for watching my PowerPoint on bipolar disorder, and I hope this gave you a more in-depth look into the disorder and important factors involved.